welcome everyone. My name is Hala. I am the integration specialist here at Fullscript. I have been working with all our Fullscript integration partners to launch, optimize, train, educate on EHR partners with Fullscript. Kalix is our newest partner. We're very excited to have them on board. And today we're going to be exploring what the integration with Kalix is and how it saves you time and how it optimizes your workflow as a healthcare practitioner. So to get started, I'm just going to go through like the agenda that we're going through today. I'm going to start with obviously just a general overview of Fullscript. If you are new to Fullscript, just want to give you an overview. And then we're going to get into the benefits of Fullscript integrations with your EHR, specifically Kalix. I'll be showing you how to set up this existing integration and then how to use it in your current workflow. I'm also going to be showing you some tips and tricks of the integration. So even if you are a Fullscript user, you may want to stay tuned because some of these little secrets or gems are not always easily visible. And then the remainder of the webinar, we're going to go through some additional resources that we've put together specifically for our webinar attendees and some next steps as well as a live Q&A. So just before I get started, I wanted to let everyone know that we'll be using the chat section of the webinar platform to answer any questions. And also if you wanted to leave comments in there, that would be great. So there's, the chat section. There's also questions section that we'll be monitoring, but it would be great to use that chat section. And at the end of the webinar, of course, I'll go through these questions, but I also have my colleague, Alan, who is joining me today from the Fullscript team, who could also be answering questions as I go along. Great. So without further ado, let's go ahead and get started. What is Fullscript? So just generally, Fullscript is the ultimate platform for various healthcare providers to recommend professional-grade supplements and help patients get better. As dietitians or other integrative healthcare practitioners, I think you'd all agree that treatment can mean many different combinations of things. This includes diet, lifestyle, exercise, and much more. But quite often, diet changes need to be supplemented with nutraceuticals. And this is where Fullscript comes into a healthcare provider's workflow. Fullscript offers the most comprehensive catalog of supplements for you to then offer to your clients. Everything we carry is professional grade, and we are authorized resellers of the brands that we carry. So we make sure that our products are safe and authentic. Upon signing up for Fullscript, which by the way is free, so it's absolutely free to sign up for a Fullscript account if you don't have one already. But upon signing up for one, we request all practitioners to upload or provide their educational credentials pertaining to their training in the healthcare field or their professional state-issued license if you have one. So all of these educational credentials are reviewed by our compliance team to ensure that it meets the approval requirements for a program. And then through that, you'll be ready to go. It's a very easy, quick process to set up a Fullscript account. From there, you can go ahead and get started by recommending supplements hassle-free. And I say hassle-free because A, it's free to use Fullscript, and B, it requires you to not carry any inventory and not incur any capital costs. So a great way to get started if you're a solo practitioner, a new practitioner, new practice. It also allows you to track your client's wellness using our built-in adherence tools, which are also available through the Kalix integration. So I'll be demonstrating that today. And lastly, something that a lot of our users may not know is that you can earn a revenue, a passive revenue through Fullscript. Through the supplement sales that your clients make, you're able to earn a revenue. You are also able to give discounts off of the supplement sales. I'll get to that in our demo and show you where that lives. But I just wanted to highlight that if you're new to Fullscript, there's a small setup process that allows you to then make a revenue. So if you're interested in that, whenever you're signing up for Fullscript, let your account manager know and they'll help you set that up. Now, let's look into how this all relates to Kalix. So let's delve into why this integration was built in the first place. If you had ever carried inventory or dispensed supplements prior to this integration, online or otherwise, this could have been your workflow. You could have seen that you would have had to kind of write a full script recommendation or a supplement recommendation to be sent to your client, and then separately go into your EHR with Kalix or otherwise, and then separately log that in. It's a duplication, a convoluted workflow. And then same thing for the clients. The clients will get confused because they're getting, multiple sources of information of what to do with their wellness. So that's really where the integration pain point lives. And if I'll stop here and kind of ask, actually, if you can comment in the chat section, is this something that you've seen in your workflow? We're just curious to see if there's this hunger for this integration, if this is something that you've been waiting for, if you're an existing Kalix user that hasn't been recommending supplements, and now with this integration, notice that this could be a pain point. Let us know. We'd love to hear your comments. But realistically, the integration is built to simplify this very workflow to a one-step process. So it allows you to pretty much do everything in one step. The Fullscript integration lives within your Kalix account, allows you to recommend supplements from within there and store these supplements accordingly. The information is always pulled back between the two platforms without any manual intervention. So no longer will you need to duplicate your work. It's a more optimized solution. I'm getting some comments here. There's still some questions coming in. Wonderful. So for practitioners, I just wanted to comment that for practitioners who have always wanted to learn more about supplements, but didn't know where to start, or those that have been recommending supplements but wanted to learn more about specific brands, the integration is perfect for you because Fullscript offers specific protocols and actually tons of education on supplementation. And I'll be getting to those specifics as well in our demo. But I really wanted to highlight that we are there for you every step of the way. We would help you get started with also how to dispense supplements. And this is especially true today with the current global health crisis. We know that as practitioners, you're probably required to evolve rapidly in the way you provide your clients with health. We know it's been challenging, and also we know that this could be an opportunity for integrative medical community or the integrative medical community to come together and leverage these new technologies, these new tools and resources that allow practitioners to connect with their clients in a meaningful way. This is why we are excited to have launched this right now, because we want you to, in this time, stay organized, make sure all your information for all your clients is stored in one place. You're not having to go around trying to find that. You're able to gain access and start incorporating, if you haven't otherwise yet, start incorporating these professional grade supplements into your offerings, all within your Kalix platform or dashboard, and doing so, and whilst then also earning a revenue. Really, ultimately, it becomes an easy way to run your practice anywhere because of the connected integrations. This allows you to thrive whilst delivering your care virtually. And actually, an added bonus here, Fullscript does provide all new practitioners access to educational content, but specifically, we recently put together an entire educational series on practicing virtually. And that's linked here. All these slides and the resources are going to be shared with you right after the webinar, but that would be a great tool for you to get started on if you wanted to take your practice virtually and learn more how to do that. So with that, we're going to go ahead and start our live demo. So we're going to showcase how to use the integration, how to set it up, and how to begin using it. I'm going to, exit out of my slides and go into my Kalix account. So make sure, let me know, guys, if you're able to see this. If you're not, again, all of this is going to be put together in a video sent to you. So no worries there. Setting up the integration is very easy. It's like a very simple 3-step process. I'm going to be demonstrating that right now. As you can see, I am logged into my Kalix account. This is a Kalix demo test account. First step, obviously, is to have such account. So if you don't have a Kalix account prior to this, create one. Kalix is an EHR platform dedicated to integrative practitioners, specifically registered dietitians, but not limited to. And actually, we have a Fullscript promo code that you can pull into using Kalix. So Kalix actually gives you a free 30-day trial, but upon subscribing, you're able to use a promo code. I'm going to be sharing that with you in a couple of minutes there, but a great way for you to kind of get that discount. So from there, let's go ahead and get started with setting up the account. On the right-hand side, you should be able to see your name or your practice name. You can go ahead and click there and go into account settings. There's a tab for integrations. Go ahead and click on that. And that's where you should be able to see the Fullscript logo that allows you to go ahead and connect your account. I'll stop here and say, if you are not the account owner of your Kalix account, then you'll need to direct the account owner to do this because you won't have access to the settings right here. So we're going to go ahead and click connect, and that's going to direct us to the authentication step. Now, I have already connected these two accounts together, so this is why it's taking me to this step. But if this is the first time you're doing this, the first step is actually going to be to, once you click on that button, is going to be to log into your Fullscript account using your Fullscript credentials, so email and password. If you don't have a Fullscript account, that's okay. That same view is going to give you the option to create a Fullscript account. As I mentioned before, Fullscript is free, so go ahead and create one. And actually, we are giving away 5 free shipping credits to all our webinar attendees that sign up for Fullscript this week. And I'll walk you through what those 5 free shipping credits can do and where you can use them. But a great way for you to get started with Fullscript this week and take advantage of that promo. So once you've created or signed in to your Fullscript account, then you'll see this and you'll be able to click Authorize Application. And that basically connects the accounts together. I need to do this one more time. Since I've connected prior, so it needs a little step here. There you go. So we've connected the main Fullscript account. We can open up here to see who is linked on this Fullscript account. So myself here, I am the account owner, and what you'll need to do on your end is connect yourself to your Fullscript account. So what we're doing here is the Kalix accounts are on the right-hand side and the left-hand side, and the Fullscript ones are on the right-hand side. So go ahead and connect yourself using your name or your email here to your actual user on Kalix. If you have more than one practitioner added to your Kalix account, so if you're like a clinic entity with an account owner and the various providers, the same thing could apply to your Fullscript account. You're able to add your providers onto your Fullscript account as well. And it divides then who's been recommending what to which patient or client, so on and so forth. So in this case, we have Claire added in this Kalix account as a practitioner. And what we can do is then link her to the Fullscript account. Say Claire is not added to your existing Fullscript account, what you can do is actually invite them to your Fullscript account. So if they're a new member or you forgot to add them to your Fullscript account because you're new to Fullscript, that's okay. Click on invite to Fullscript. That adds them to your Fullscript account and sends them an email to accept that account. So this way you'll connect both of the users and both of them will be able to recommend supplements through Kalix. What this integration is very unique in doing is actually adding another level of ability or flexibility into your integration. So if your other providers on Kalix actually have their own separate Fullscript accounts that they would like to use with this Kalix integration, all you'll need to do is check the toggle so that it's orange. This will allow each provider, so in this case, this will allow Claire to actually go into her My Details page and connect to her own Fullscript account, so that you're not having to add her, or in this case, the other user, to your own Fullscript account. So this allows for flexibility because we never know how the practitioners have been operating and using Fullscript separately. And there you go. We have officially completed and connected the integration here. So make sure you use the chat section and ask any questions specifically about connecting, but we're pretty much ready to start dispensing supplements or recommending supplements to the patients. So we're going into our client tab right here. So again, to reiterate, obviously Fullscript is being used or is a platform used to dispense supplements now within your Kalix account. So to do that, we'll need to obviously go into the client tab here. You can go ahead and add a new client. Once you add a new client and start writing them a Fullscript recommendation, they'll automatically be added to your Fullscript account. So no longer do you need to separately log into Fullscript or another platform and separately add patient information. It's all built into one step. I'll just go ahead and use this test client here. As you can see, there's a Fullscript tab. This is what allows you to go ahead and write recommendations. What it first does is actually pull in any existing recommendations. So if you are not new to Fullscript and but new to the integration, it will pull in any of your existing work that you've done on Fullscript prior. So you're not losing any information, you're not having to go back and forth here. It's all going to be pulled in. It also shows you orders. So that's the adherence aspect that I was talking about earlier, which I'll delve into with more detail. But that's the order section that allows you to see if the orders have been placed and what these orders were. Let's say for the purposes of this demo, we want to write a new recommendation for this client. Just going to go ahead and click on this plus sign. And this is what it's redirecting to right now, the actual Fullscript integration. It's redirecting to your Fullscript recommendation tab for test client in this case. So if those of you, or for those of you that are familiar with Fullscript, you've probably seen this page before, but I will be highlighting some aspects that you may have missed. So this is the exact page that you would write a recommendation for a client with specific products that you want them to go ahead and purchase so that they can go ahead and purchase. On the right-hand side, there's a drawer. And what I wanted to highlight is under the client tab, obviously it shows you any live recommendations that you're able to see, so kind of adherence and orders. But this little gear icon has a gem, has this discounts section. So I told you before that there's a way for you to give or to earn a revenue through Fullscript. There is a small setup for that actually. If you see here, my account needs some more information before I get paid. So that's the setting here that I'm talking about. If you were to be making a margin on Fullscript, make sure you click on this continue button and make sure you set up your payment information. Our account managers who help you set up your Fullscript account will walk you through this. So it's okay if you forget. We'll make sure that you do get paid for your margin. Now, having said that, a part for your margin can actually be given to your clients in a form of a discount. And that's this setting right here. So you can give your client 10 or 15% discount. This comes off of your margin, but allows the client to see that they have a discount off of their supplements. And it is a great way to maintain and continue building adherent clients. So I would always recommend a 5 to 10% discount. There you go. We've saved the discount. Now we're ready to go ahead and start recommending items. The message section is a great way for you to connect with the clients, let them know below's their recommendation. This is what I want you to take. This is your next appointment, links or documents, so on and so forth. And then we get into actually searching for items. So this is a great way. So there are a couple of ways that you can actually add products into your recommendation. I'll be highlighting most of them, or actually all of them, starting with your favorites. So you can build favorites or favorite items into categories that you can then save and have easy access to here on your Fullscript account. These are completely customizable. You can name them whatever you want. You can add whichever items you want in there. We do have some suggested categories though. So if you were to go to the catalog tab, once you're setting up your favorites, you're able to see our suggested categories. And we do showcase the top most recommended items per category. So again, this is a good way for you to get started and do some more research on these top recommended items. Let's go ahead and say we're going to do sleep support, and we're going to go ahead and recommend one of these items. There you go. So it recommends the item right here. A side note, what it also does, if you were to click on the product name, it obviously then shows you the product description. What is the product? What is the price? If it's in stock, it actually also shows you similar products, which is going to be, which will come in handy in just a couple of minutes here. But basically, this is curated by our team to ensure that they have somewhat similar ingredients. Say one item is out of stock, you may want to replace it with a similar item. And of course, description and ingredients. So a great way for you to then learn more about supplements and about ingredients. The second way of recommending supplements into your recommendation is actually through templates. So templates, differently from your favorites, are a way for you to customize an entire protocol of items that you want to automatically recommend to that client. So they become a very efficient and effective way for you to get started. I'm going to use the cold and flu support here. And actually, a quick tip is we have some curated evidence-based protocols ready to go. So I'm going to link them at the end of this webinar, but we do have some protocols ready to go. For example, this cold and flu support protocol has been uploaded from our website into this account, and it's live on your Fullscript account. It will also be live on your Kalix integration since it's all built into one step. So you can go ahead and apply that template or that protocol. And what it does is go ahead, it applies all of the items here. It also sometimes it would give you a notice if there are items that are out of stock. This is great, and I'll be showing you exactly why. So you've built these templates prior to writing this recommendation, and stocks change daily. So if an item is out of stock, it actually gives you a notice, and you are able to then click choose a similar product and actually replace it. So this is where these similar products become very useful. You can just go ahead and replace it right away. If there's something that you just want to remove from your recommendation or the protocol, you can just go ahead and do that as well. So there we have it. We've uploaded a full list of items. We went ahead and replaced one of these items because it's out of stock. We've searched through a category. And the last thing is obviously to search for actual products if you haven't saved them prior. So if you just had found out about a new product and you know its name, you can go ahead and search for it. Pulls in, you could go ahead and add it. If you know about a specific brand and you want to actually just browse the catalog for that brand, you can go ahead and search for that brand. Again, pulls in all the items of that brand and allows you to then just go ahead and add to it. And lastly, say you're looking for a supplement type. So the best example would be like probiotics. You're looking for a specific probiotic and you're looking for criteria, but maybe don't know the exact name of the product or the exact brand. These are built-in categories. They're different from your favorites because they are subcategorized into ingredients or criterias. So for example, if you wanted to go into probiotics, let's go ahead and pull in the probiotics tab here. It subcategorizes everything for you. Say you want a single strain because you don't want to be going through 294 probiotics to find exactly what you're looking for. Say you only want a single strain. There you go. That obviously then filters the number of results. Say you want a specific strain. There you go. We're filtering, we're sub-filtering the search results so that we're not having to go through various products. Now we've narrowed it down to 4 of that specific type of probiotic, and you can also browse some of the other categories or filters that we have here. Say you wanted it to be vegan. There you go. We've only had 1. You can go ahead and click on it. It gives you, again, the information, the ingredients, and allows you to go ahead and add it. We've completed putting in our entire recommendation here. Now we want the client to go ahead and purchase these items. What we want to do is obviously send it to the client. Side note, a great way to increase adherence is to text them because, if you're comparing a text versus an email, likely someone will get to their texts much faster than they would email. So I would highly recommend you check this yes. Actually, the cell phone number is being pulled in from the Kalix account. So if you've added the cell phone number to your client account on Kalix, it pulls it in very swiftly. So you don't even need to remember these cell phone numbers or go back and forth to copy them over. Otherwise, of course, you can unselect if you just want to send it in an email. So we're ready to go. Let's say we want to send it in an email. A little side note, which I'll elaborate on, you can actually place the order right there and then. So if the client is physically with you, or if you're on the phone or doing a telemedicine call with your client and they're like, okay, you have my credit card, just go ahead and place this order for me. You're able to click on this item or this button, and that takes you to the checkout process. But for today, let's say we're gonna send it to the client. We've ultimately finished up the recommendation. Now what we want to do is just go back to our Kalix account and see. I actually just got the text message. And there you go. Today's the date, and this is the recommendation. We just had to refresh the Kalix account to see this recommendation pull into Kalix. And if you were to open it up right here, you'll be able to see the exact items with the message as well, and if it was ordered. So great way to just connect everything in one go. And if you were to just scroll down to the end of the recommendation, that's the in-office checkout button again. So if after sending this off, your client calls you and they said, oh, you know what, I just want you to place this order for me right away. I'm not near a computer or I'm not on my phone, you can go ahead and click on in-office checkout. Again, directs you to that very experience on Fullscript to add the shipping and credit card information. Otherwise, there's the recommendation link. So this is a great way for you to kind of reinforce the recommendation. So the recommendation is already sent to the client in an email and in a text message, right? But if you wanted to add it in the additional documents that you're sending or your follow-up notes, you can go ahead and click on recommendation link. This is a very unique link that directs to that specific client and to that specific recommendation. So it's the best way for you to have the least amount of confusion for the clients, right? So you can go ahead and paste that, send that in an email, so on and so forth. They'll go ahead and get redirected to their account. Everything is HIPAA compliant. They can go ahead and get redirected to their account to place the purchase. And then the last thing here is actually just drafts. So you're noticing here, if you notice that the Kalix integration does pull in the draft section as well. So if you left halfway through writing a recommendation, you're able to then say, oh, okay, I need to send this off right away. You can go ahead and send it all within the Kalix integration. So you don't lose any of your data. You don't need to log into Fullscript to find it. It's all in here automatically, as well as I was saying, the orders section. So orders is great. It'll give you a great feel to if your clients have been adherent or not. And again, a good solution if you see that this is a zero order is just check in on the client, send them a quick email and include that recommendation link so that they don't forget where to go. That is, I think that's pretty much it. Let me check my notes. I think I've demonstrated all the aspects that I wanted to. Of course, if you have any feedback or any requests about what you'd like to see in this integration, let us know. Questions or chat section would be great. Otherwise, I am just going to go back to my slides here and walk you through some of the resources that I told you we have prepared for our attendees today. So in terms of resources, um, if you're new to Fullscript or new to dispensing supplements, the Medical Knowledge Center that we have on our Fullscript website is a great way to get started. It has everything from patient handouts to education on supplements to ingredient-based search. And in addition, it has the link to our protocols. So these are evidence-based protocols. They're curated by our integrative medical advisory team, put together, and it gives you all the research that you'll need to learn more about these protocols. And with one click of a button, these protocols become saved on your Fullscript account, and then in which case they can be used through the Kalix integration. I will again stress and highlight the educational series that's very recent, very new to Fullscript about practicing virtually, especially right now. If you're looking for more new tools to practice virtually and dispense virtually, that'd be a great resource to get started with. And finally, more information about Fullscript, just in general, Fullscript and the integration, you can go ahead and get started by clicking here. In terms of your next steps, if you don't have a Kalix account, as I said, go ahead and create one. You have a promo code Fullscript20. That's the promo code to use whenever you are subscribing for Kalix. As mentioned, there's a 30-day free trial, but after that, if you want to subscribe, you can use Fullscript20. You'll get 20% off for the first year of using Kalix. If you are new to Fullscript, sign up for Fullscript. This is a very specific link that will be shared after the webinar. It's tracking those that have registered and attended the webinar. And we want to give you all 5 free shipping credits to start using Fullscript this week. So if you sign up this week, so that's today and tomorrow, we can go ahead and give you these 5 free shipping credits. These shipping credits can be used on yourself. You can actually place a test order on yourself, give yourself like a full discount off your margin. And use this shipping credit to order supplements for yourself. It could also be used for friends and family. You can easily add a friend or a family member to your Kalix and or Fullscript account and apply that shipping credit. To get these shipping credits, as soon as you sign up for Fullscript, regardless, an account manager will be connected with you, but respond to our emails or connect with our support team and let them know I have 5 free shipping credits and I'd like to have them apply on my account. And of course, I have a step-by-step guide to actually set up and use the integration. Pretty much everything I talked through in this webinar is in this list here of integrate. And that's pretty much it. I am going to open up the floor for questions. I'm going to go in and read through some of the chat and questions, but I wanted to link in a book a demo link here. So if you wanted to meet with any of our account managers to set up a Fullscript account, to set up the integration, to learn more how to optimize and grow your Fullscript practice, go ahead and book in with our specialists. Otherwise, you can also chat with us. So this directly goes to our customer support or success team. They're available via chat and with instantaneous support. They are able to give you the answers you need almost instantaneously. And that is pretty much it. Let me open up my camera, exit out of this screen share, and take a look at some of the questions coming in. Okay, there you go. Okay, let's see. This is a great question. What are the implications for liability insurance and selling supplements? What are the changes, if any, that has to be made with insurance? So obviously connect with your insurance on this. I wouldn't call myself an expert at all, but from my understanding, the Fullscript margin is really to replace what you would have made if you were carrying inventory. And we do have an option for you to actually make no margin. So I would say connect with your insurance if this is pertaining to margin. If it is pertaining to recommending supplements, most of these supplements obviously require or ask you to ask the patient to connect with their healthcare provider prior to taking those. So I would say just connect back with your insurance to see if you have or you're within the realms of recommending supplements. So registered dietitians, for example, are. Does the Fullscript integration only work for virtual plans or for all plans? Definitely works for all plans. From my understanding, regardless of the pricing or tiered structure that you have on your Kalix account, it works. You're able to set up the integration with all of them. Are dietitians covered under liability insurance? I wouldn't be the expert at that. I would say connect with your insurance. I would also connect you with our support team because we may have our compliance team that could answer some of these questions. I can't integrate my account, but I do have a troubleshooting at 4 with Kalix. Okay, great. So if you have had trouble connecting your account, it's great that you're booking in a call with Kalix. We're also available to connect. If you want to connect with our support team, we are available and can help you as well. But I'm sure either one will be able to help you. Could clients also be able to place their own orders on Kalix? Great question. So the way that the integration works on the client end is that they get an email from Fullscript and they are able to go into Fullscript to place an order. From my understanding, clients don't necessarily go to Kalix to view any records or updates. The records or updates all come from you, and then also they will get to go to their Fullscript account to place their orders. And they do have access to place their own orders that are outside of the recommendation. Definitely. That's actually a setting that you have on your Fullscript account to provide clients access to the entire product catalog or only the items that you have specifically recommended. So that's actually under your catalog settings. If you have questions or can't see that, connect with our support team through the chat section. They can easily allow you to find that for you. What platforms can you get revenue through? Can you have earnings sent to your PayPal? Oh, it actually goes directly to your bank account. So the question about the revenue, in the settings of Fullscript, we'll ask for you to add in your direct deposit details. We use Stripe to integrate that and pay out the revenue on a weekly or monthly basis, or the cadence is up to you. I think the default is monthly, but you can request a more frequent payout. But no, we do not use PayPal to issue payouts. It's going to go directly to your bank account. Is there a way to import the recommendations from other platforms into Fullscript on Kalix? I'm not sure here, that question. What other platforms are you referring to that you would like to import? I'm not really sure. Connect with us directly through our book a demo to inquire further. But from my understanding, recommendations on other platforms cannot necessarily easily be transferred onto Fullscript. This is all within the Fullscript and Kalix integration because we've built that integration. So it really depends on this other platform and if we have an integration with them. Another question I have is if Fullscript offers CBD. Great question. So Fullscript actually does not offer CBD at the moment. However, we do have a sister company called Natural Partners. It's the company we're merged with Natural Partners. Natural Partners allows you to carry in-house inventory, and through your in-house inventory is where you can buy and sell CBD. So it's not directly available for clients to purchase through your Fullscript account, but you can choose to order it and sell it in your practice. Oh, and then real quick, if you wanted to create a Natural Partners account, that's naturalpartners.com, or connect with your account manager on Fullscript, or connect with us through the chat section, and we can set you up with a Natural Partners account. Wow, we're getting tons of questions. That's awesome. We have around 10 minutes, so that's great. Is there a way to see which clients have Fullscript linked when just looking at the current client list? Yes, there is I would say the quickest way to do this is if a client does not have any recommendations on your Kalix account, that you don't see any recommendations in there, that likely means that you've never written any recommendation on Fullscript for them. It could also mean that they're not on Fullscript yet. So that would be the quickest way for you to note if you've done anything with this for this client on Fullscript. If they have orders without recommendations, that should show up as well. It should show you the orders, I believe. Actually, I'll make a note to connect and ensure about that. But yeah, that would be the easiest, quickest way. I would also add that really, because of the way the integration works, it either adds a new client or matches the new client. So you wouldn't necessarily need to know which clients have or don't have a Fullscript account, because as soon as you write them a recommendation, they'll either get one or they'll get a new recommendation. But definitely, I would say connect with our support team or book a demo for more kind of optimized solutions. So if you're thinking of more of a creative way to use this integration or to use Fullscript, connect with our account managers. We have actually optimizing account managers that work to grow your existing Fullscript business. In regards to the preloaded supplement template based on evidence-based protocols, where can I see the evidence-based library for that protocol? Within the protocol. So if you go to fullscript.com/protocols, that shows you all the protocols that we have. If you click on a specific one, it gives you the entire evidence per product. For example, with the protocols, we direct you to ingredients, not specific products. We direct you to, let's say, vitamin C, that for cold and flu, it's great to use vitamin C at a specific, dosing. So we direct there and we provide the evidence for that. And then we show you some of the vitamin Cs that we have available that are part or that are within that dosing. So I would say go to fullscript.com/protocols and you should be able to see it within each protocol. Does the Fullscript integration have the ability to compare against the patient's medication for any interaction warnings? Great question. This is coming. I would say that's all I'm at liberty to disclose, is that this is definitely something we thought of and a great suggestion, and is something that we want to actively pursue. However, pertaining to this specific integration, we'll work with the Kalix team directly to see where medication actually goes into Kalix, because I haven't seen it directly. How to filter for USP verified products. I'm not sure we have that as a filter, to be honest. Yeah, I don't think we have that as a filter just yet. We're working though, we're always actively working on our product catalog and on updating these filters. Yes. So there's a question here coming in that, Fullscript is fully HIPAA compliant. If there is a BAA that we have that you can sign, definitely. So if you were to sign up for Fullscript today, make sure to connect with the account manager, respond to the emails that we'll probably send you, and say, I'd like to sign a BAA, and we'll send one over to you. We do have other integration partners. So if you are inquiring about other platforms that we integrate with, so other EHRs or other practice management tools, we do have other ones. Today, I wanted to focus on the Kalix integration, but if you wanted to get more information about all the integration partners, fullscript.com/integrations. Everything is available on our website. How do I see how much the total order will cost the client, including shipping costs? So this is a great question. So shipping is actually depending on the client. The client will select or choose the shipping option that they want. So we provide you with the subtotal in the Fullscript recommendation, and we show you the discounts that was saved. So if you were to have seen in my demo, when I pulled in right before I went ahead and clicked send to client, it will actually show the subtotal and the discounted total if you were giving a discount. But in terms of shipping, the client actually chooses that, so we don't add that for you to see. In terms of the shipping options, we have 3 different shipping options, and we do have free shipping above $50. So clients can really get a really good deal. And I would say Alan maybe can link up the shipping link because I can't remember them off the top of my head. Does the client pay Fullscript directly? Is there any cost to the practitioner? Absolutely not. There's actually no cost to the practitioner. This is what's great about Fullscript. It's free. The clients will pay Fullscript directly for the supplement items themselves, including or excluding any discount you provided. And then on the back end, what we do is provide you the margin and send that over to you in a direct deposit. So we work with obviously the brands that we have available that we distribute products for and divvy up the margins accordingly. But on the practitioner end, it's free for you to get started and to use. Shipping options being linked. Thanks, Alan. I think I have a couple more minutes here. If you just signed up this week on Fullscript in preparation for this webinar, can the 5 free shipping credits be used? Absolutely, yes. Connect with your account representative if you haven't done so already, and let them know that you were part of this webinar and that you wanted the free shipping credits. Absolutely. Oh, what if it was made prior to this week? Still eligible? Yeah. So for the 5 free shipping credits, honestly, we're hoping to kind of grow and get you started with Fullscript and with using Fullscript. So if you wanted these free shipping credits because you're new and haven't placed any first-time orders at all, then definitely connect with your account manager. You already have one, and let them know that you were part of this webinar and that you wanted the free shipping credits. Absolutely. Does Kalix offer video conferencing with clients? I will say yes, but I will defer to Kalix directly. So you're able to connect with them through their support and chat for more information about their specific features, but I want to say yes. We're getting a ton of other questions, which is pretty awesome, honestly. And what I would say is if we don't get to your questions within the next couple of minutes here, don't worry. We have everyone's emails from this webinar. And we also, if Alan, if you can just let them know, let our attendees know to give us their emails, and we can go ahead and connect with them and answer any questions that we haven't answered. Really quickly, I have a couple of minutes to get to some of the questions for the revenue. Do you need to send W-2 forms? So you would need to if you are making more than $20,000 annually through Fullscript. Otherwise, you wouldn't need to. But we have some more details on that on our support page, so we can connect you with that link or that specific support page right after the webinar. As well, I would always say these very specific questions where you wanted more details about the margin or more details about your account or to grow your account, your sales account manager would be a great resource to take advantage of. Kalix is a US-based system, so US dollars. So Kalix is a US-based system. However, they do operate all internationally. Fullscript operates in Canada and the US. What I've demoed to you is our US environment, but we do operate in Canada, and the prices would be in Canadian dollars. So if you are a Canadian practitioner wanting to set up this integration, you're able to do so, and Canadian dollars will apply to you. Yes, if you already have a Fullscript account and are new or haven't really placed any orders on Fullscript, you're able to get those free shipping credits. Can you use the promo after a month of free Kalix? Yes. Actually, so which promo? So the promo, the Fullscript 20 promo on Kalix is it's to be used after the 30-day free trial to get 20% off for the first year. One more. Does Kalix receive a margin for the use of Fullscript? Absolutely not. Is Kalix, okay, that would probably be our last question. Is Kalix recommended if you were not a practitioner who accepts insurance? I wouldn't be the expert at that, honestly. I would say yes, they do have tools if you do accept insurance to help you process your insurance claims. I would connect with them directly. So connect with them directly on that. There are other platforms that are specific to those that don't use insurance. I would suggest you go to fullscript.com/integrations because some of the tools that already integrate with Fullscript are specifically designed for those that don't necessarily use or use insurance or accept insurance. Alan, if a couple are coming in, let's just try to answer them. But again, as I said, we will get to all your questions after the webinar for sure. We have everyone's emails. We'll be able to connect. So many questions. So the video conferencing, I mentioned that I see, yes is the answer, and connect with Kalix on it. For now, you can't delete a draft on Kalix. Unfortunately, that's actually feedback that we will consider. That's a great comment, but you can send it off to the client. Okay, last question. I guess my team here is letting me know that we are getting so many questions. Okay, so this will be the last one, but yeah, we'll definitely connect with everyone after. I'm new to Fullscript. Does Fullscript show retail and wholesale pricing? We only show retail pricing. So the Fullscript platform is really meant for you to dispense supplements to your clients that will be paying the retail price. So we show the retail and then we show the discounted price based on the discount that you provide. Wholesale is a different story. That's right now under our sister company, Natural Partners. So if you are looking to purchase wholesale, create a Natural Partners account. And you're able to do that by connecting with our support team. They'll be the best resource to do that. naturalpartners.com. Okay. Kaylee and Ellen, let's go ahead and wrap up today so that we can get this video out to our registrants. But as mentioned, if there are additional questions, we will be getting to them and responding in an email to every single one of you. Thank you all. Thanks for everyone who tuned in, and thanks for everyone's questions. This was a very engaging webinar, and stay tuned for more updates and more follow-up.